Bismillahirrahmanirrahim. Today we will talk about how to pass FCPS TOACS Part 2 Gynae in first attempt. So you need to know that there are the 12 to 14 stations, which includes the 2 short cases, which are the link stations. These are total 4 in number. The Gynae 1 link station, the station number 1 includes history and examination. The station 2 includes investigation and management. So is the case with the OPS case. The OPS link station will include station number 1, in which you will take the history and examination in 10 minutes, and then in the station and also discuss and present your case summary to the examiner, and then in the station number 2 will be regarding investigation and management. In station 2, first of all, you again have to present a case summary to the patient, so to the examiner, and then ask about the investigations and discuss the different management options of that particular case. These will be your 4 stations. To cut down rest of the stations in your exam, they include counseling station. There will be 2 to 3 structured discussion. In the structured discussion, there will be any case scenario, after which they will inquire you about the history, examination, investigation points, and the management points. Examiner will give you the positive findings in the history, examination, investigation, and then further if you inquire that particular finding. So, in the structured discussion, be precise, related to your case only. Do not have a broad history, just focus on that case and then have a discussion related to the history, examination, investigation, and that management of that particular case. Then there will be the station 1 to 2 stations regarding the research, audit, clinical governance, appraisal, and protocol. According to the latest CPSP notification, there will be the 1 station related to the audit or the research in upcoming exams in future. So this will be the 1 station, and we will discuss each station in detail in further videos. 2 to 3 stations are related to the drills, which includes OPS drill and the Gynae drill. And 1 station is particularly about teaching. You will be asked to teach your junior, resident, or house officer or any student regarding any particular drill or any how to interpret any investigation, for example, urodynamics. So this belongs to your teaching skills. And the more important and the last station includes the labor board or the Gynae board. In the IMM exam, we have already done the labor board, but the Gynae board is new to the FCPS Part 2 exam, which can be the how to focus on the pre-op preparation of any Gynae list on the day of the Gynae cases, how to prioritize your cases, and how to manage all the post-op Gynae recovery room, how to prioritize further that post-op patients. This includes the Gynae board. These are the different types of the station you will encounter in your FCPS Part 2 exam. The modules to be covered which comes in your exam, and the station is allotted to that particular module. They are 12 to 14, and the modules include maternal medicine, which includes diabetes, hypertension, etc., epilepsy, antenatal care, labor and delivery, postpartum problems and puerperium, the gynecological problems, the station about subfertility, 1 station about sexual and reproductive health. 1 station can be about sexual assault and domestic violence. 1 module to be covered includes the early pregnancy care, which includes hyperemesis gravidarum, miscarriage, abortion, ectopic pregnancy, ovarian hyperstimulation syndrome. One of the module and the one must station in your exam includes gynecological oncology. The other one is urogyne, and then comes the post-operative care, the core surgical skills. One station or module is the teaching skills, and then the research. So let's break down each and every module and let you people know which type of the station will be covered in each module. In the maternal medicine and antenatal care, you can encounter the short cases, which are the link stations, for example, diabetes, hypertension, anemia, ops coli, epilepsy, thalassemia. There will be the structured discussion on any of these topics and any of the maternal medicine and antenatal care topics. They can be the counseling like pre-pregnancy, thalassemia counseling of that particular station. So these are the type of stations you can encounter in your exam related to this module. In the labor and delivery, you will be asked or assessed according to the drills. More importantly, WHO Labor Care Guide, which is the new and has placed the partogram, the labor board, and structure discussion and the teaching. Any of the type of the station can come related to this module. In the puerperium or the postpartum problems, the stations you will encounter can be counseling, structure discussion, short cases. The short cases like the link stations. In the gynecological problems, the stations you will encounter are the short cases like heavy menstrual bleeding, prolapse case, mass in abdomen, fibroid uterus. These can be your link stations. Any other stations which includes the gynecological problems can be the structured discussion and in the form of counseling. In the subfertility, you will be assessed either in the form of short cases like link stations or any structured discussion, any counseling related to the subfertility or any drill, for example, IUI, cannula use. In the sexual and reproductive health, you will be assessed on either of the following, either the structured discussion, counseling, and it includes all the STDs to be covered in this module. Early pregnancy care includes structured discussion, counseling, and short cases, for example, ectopic. Short case means the link station, and it can be the case of ectopic, and you will be asked about the different management options of the ectopic pregnancy related to that case. In the gynecological oncology, you will be assessed in the different types of the stations like short case, counseling, and structured discussion. Remember, with each module, there will be only one station. And I am suggesting you and telling you that these are the type of the stations like structured discussion, counseling, or link stations, which can be covered in this particular module. For the urogynecology, which is a very important module, and one station is must from it, it can be either the structured discussion, the counseling, short case, for example, prolapse, incontinence, the teaching of the urodynamic lab interpretation, and any drill like transvaginal trape insertion and any other procedure related to the urogyne. Then comes the post-operative care. It can be either the structured discussion, it can be either in the form of counseling or gynae board. In the core surgical skills, it includes a structured discussion, drills, teaching. For example, laparoscopy could be asked. And in the teaching station, there can be the drills. In the teaching station, you will be asked to perform any drill and teach your junior. They can be asked to teach the labor care guide and how to fill that labor care guide performer to your junior and the urodynamics, how to interpret these findings. So these are the few of the stations. All the exam stations I have discussed so far. For the further details, join and see the next video. Thank you and good luck.